So like through this tactic that's known as governance by delegation, everything just kind of gets stripped away and budgets get pushed off to these really vague local groups. And it all just sort of fragments the government's actual legal duty. And partnership suddenly becomes this euphemism, and when care fails, there's just nobody left actually holding any responsibility. And then you look at these liability loops and it's like complex patients just bounce around between all these administrative silos until they eventually hit a wall. And these really vulnerable people end up becoming like hot potatoes, trying to coordinate their own survival right in the middle of a crisis. And then you've got this 37% spike in youth self-harm admissions, which is just heartbreaking. And frontline staff are dealing with this really deep moral distress, carrying the weight of a system that's just broken. And the sad truth is that instead of actually using the law to improve safety, the system just let autonomy run completely unchecked. So every part of the NHS ends up kind of governing itself. And that creates this fragmentation that harms patients and totally exhausts staff. The human cost is honestly just devastating. And it really makes you stop and think like, is this just poor management or is there actually a deliberate attempt to sort of sidestep public responsibility? And the thing is, the 2022 Act already shows that the government has this really clear legal power to step in. So to actually fix any of this, we have to start asking for answers to these 4 really fundamental steps of accountability. Because the law is super clear, the NHS is a national service and that duty of care is there. It's written into the Constitution and it kind of sits above all the managerial complexity that people sometimes use as an excuse. And if politicians already hold the legal levers right now, then why are they hiding behind this sort of paper shield of bureaucratic success reports? Like the legal responsibility already exists. And yet all this immense human suffering just keeps going. So what is it really going to take to break through that sort of safety mirage and actually start legally protecting human lives?